Okay, so it's just turned 1 o'clock, so I'm going to make a start. So first of all, good afternoon, everyone. Many thanks for joining me on this webinar today. My name is Charmaine Jackson, and I head up the training team for Ardens. And I've got two of my colleagues on the call with me today. I've got David Dover, who's one of our product specialists, and I've also got Georgina Ford, who is our team leader for the Ardens Manager support team. So they're going to be helping me with the questions throughout the session that you may have, and I'll talk about how you can answer questions as we go along shortly. So this webinar is going to be focusing on how Ardens Manager can help you with managing the national vaccination programs effectively. And that's by planning and monitoring activity for your practice, for your PCN and for your ICB. So I'm going to be covering areas such as flu, which is obviously quite popular right now, RSV and also COVID. And all of these, this data on the dashboard will be able to help you analyze trends. It will be able to help you identify your at-risk patients so you can prioritize those and just generally prioritize the vaccination programs. Now, before I get into the nitty-gritty of how it all works, I just want to talk about housekeeping. So you have attended a live webinar, so you do not have access to a camera or a microphone. So if you do have any questions or any feedback that you'd like to answer us throughout this session, then if you use the Q&A option, which you'll just see on your normal Microsoft Teams functions, then you'll be able to post those as we go along. Now, the session's been scheduled for 1 hour. It may not take that long. It just depends on the questions and the feedback that you have throughout the session. And the session is going to be recorded as well. So if you want to share this with your colleague, or if you want to watch it back, then you'll be able to watch it as many times as you like. And what we'll do is I'll get Dave and Georgina to pop the link to where you can find all of our recorded webinars. You've got that right now, just in case you need to leave the session early at all. And at the very end, I will talk to you about training too, and how you can tap into that for you and your practice, or maybe you're working as part of a PCN or an ICB. Training as part of Ardens is free, and you can have as much training as you like. So I will make sure that I'll share the details of that later on at the end of the session as well. Now, this particular webinar today is going to be focusing mainly on Ardens Manager. So it's going to be looking at the vaccination dashboards. I'm not going to go into the clinical systems and show you the searches and the different protocols and templates that we have available to support you with the vaccinations. This is mainly going to be looking at the dashboard, but we have just recently delivered webinars for our Ardens EMIS customers and also our Ardens System 1 customers as well. So if you missed those, I tried to be a little bit techie with the PowerPoint slides, so hopefully this actually works. So if you've missed those, you have got your QR codes there, so you can quickly get your phone out. The left-hand side will take you to the EMIS recording, and the right-hand side will take you to the System 1 recording. But what I will do is I'll get Dave to pop in the Q&A, a link if you rather access it that way, to be able to get into those recordings. But I'm just going to hold for just a couple of seconds, just in case you have got your phone out and you want to make sure you scan those QR codes so it takes you to the recordings. And remember, this is going to be showing you how to access the searches so that you can invite your patients and monitor your progress. It's also going to be showing you, for instance, for EMIS, how you use the protocol to be able to record that vaccination's been done. And for the System 1 side, it's going to allow you to show you how to use the template to be able to record the vaccination activity too. Okay. So just moving on then, like I mentioned, we're going to be focusing on the dashboard, and there's so many different features to help you with planning and monitoring for different areas. So for vaccinations, we're going to be looking at the overview of your vaccination activity. I'm going to show you how you can monitor uptake for your at-risk patients, particularly if you want to prioritise certain cohorts of patients. I'm going to show you how you can keep track of your invitations that are being sent. You've probably been doing a lot of that work in the past month or so. We're also going to look at further breakdown so that you can understand your population a lot better, who's coming in for their vaccinations, who's not. And then we're going to look at benchmarking, because you can do that if you want to compare yourself across your local practices, or it might mean you're a PCN or you're an ICB and you want to monitor this activity across the organisations. Now, there's so much features that are available for you to help you with this work. But one important thing that you need to note, in order to see the vaccination dashboard, you have to be a national contract subscriber. So if you're not sure if you are one, then get in touch and we will let you know. If you know you're definitely not a national contract subscriber, then you can sign up for a 1-month free trial, and you can do that at any point. So if you're interested, what we'll do is we'll pop a link in the Q&A, so you've got the option to be able to sign up for a 1-month free trial and also get a demonstration with our team too. But if you're a national contract subscriber, not only will you have access to the vaccination dashboard, but you'll also have access to all of the other dashboards that we have available, such as appointments, CQC, long-term conditions, network contract DARES, prescribing, weight management. There are so many to be able to help you with managing primary care activity. And the beauty of being a national contract subscriber too is all of this information is automatically uploaded for you on a daily basis. You're looking at close to real-time information. It saves you the admin work of having to upload this information. It's all done automatically for you. But like I mentioned, you just need to make sure that you are a national contract subscriber. So hopefully that all makes sense so far. What I'm now going to do is I'm going to access the Ardens Manager platform. Now, the platform that I'm using is a test environment. So any patients that you come across on screen, or not patients really, any data that you come across on screen, it will not be real. But the actual features and how I use them will be the exact same way that you do it within your own dashboard, within your own Ardens Manager login as well. And one of the first things that I always like to remind everyone of is whether or not you feel that you've got the right staff accessing Ardens Manager for your organisation or not. So whenever you're doing a big bit of work of planning or monitoring or really fully utilising those dashboards, you want to make sure you've got the right team on there helping you to do the work with you. So therefore, what you can do is you can manage staff access yourself within your own organisation, providing you have the relevant administration rights. So just to remind you how to do that, so this is one of the first things you probably want to look at if you've not accessed the dashboards for a long time. You want to click on the 3 dots in the top right hand corner, and then go down to the option for settings. And within settings, then you can then select your organisation from the left hand side. So it might mean that you're part of more than one organisation, and those will be listed on the left hand side for you. Now, when you click on your organisation, you've got the users tab here. So if you click on the users tab, that will tell you currently who has access to your dashboards at the moment. It will tell you who your system administrators are, who your staff members are who have access, and anyone you have sent an invitation for, but they're yet to actually accept that invitation. So you can keep an eye on that. What you can then do against each of these is you can remove them as a system admin if you no longer want that staff member to be one. You can add them as a system admin if you need to. And you can also reset passwords and also add, change job titles if you need to, or remove the person from your organisation if they're no longer working with you. So this is why it's really important that we are doing this bit of housekeeping. If there are certain staff members that you want access and they're not on your list, then you can click on the Add Staff option on the top right-hand corner and then simply pop in their email address. And what that will then do is it will send them an email asking them to then sign up for Ardens Manager. So it's a really straightforward process to be able to manage your staff within your own organisation. Now, what I'm going to do is I'm going to ask Dave and Georgina, if they've not done it already, just to pop in our support article, which will take you through step by step how to use that if you want to use that going forward.
Yep,
so
all done.
Sorry, Dave, just missed you there.
Sorry, all done. Yeah.
All done. Thank you so much. Okay, so next thing I want to let you know about then is I mentioned that information is automatically uploaded for you, and that's only done if you're a national contract subscriber. So if you are, you also have to make sure that you're set up for automatic uploads. Otherwise, you're not going to see any of the information on your dashboards. So on the home screen, you've got the automatic upload section, and that will let you know currently what your status is. So hopefully most of you will be active now. Remember, it doesn't matter whether you're an EMIS practice or a System 1 practice, you still have the option to be able to have your information updated automatically. So you're looking for it to be active. If it's anywhere else in the progress there, just check to see where you are, because we might have sent you tasks or notifications on anything that needs to be completed. And remember, you will not be able to see the information until you're on an active state. If you're struggling at all with this area, then I'll get the team to pop in the support team email address so that you can contact us and we can talk you through the steps if needed. Okay, so when it comes to accessing the vaccination dashboard, that is part of the services module. So remember, on the left-hand side, this is where you can navigate to the different areas of Ardens Manager, and anything relating to vaccinations will be in this icon here, which is services. And just at the bottom of the list there, you'll then have the option for vaccinations. So we're just going to click on the vaccination tab there. And just bear with me because I am using a test environment. So what I might actually do is I'm just going to quickly swap environments just so it's just quicker for me to show you. Okay, so if I just click on the vaccination dashboard just there, it will then take you to this screen that you can see just here. So at the top here, you can see here that it's broken down by the different areas. Here's your COVID, here's your RSV, and here's your flu. It also covers areas such as childhood IMS, pertussis, pneumococcal, and shingles. And we will have a look at each of those so that you can then understand that the data that is within them. But what I am going to start with, first of all, is I am going to start with flu. So I'm going to go over to the seasonal influenza tab. And remember, this information is uploaded on an almost daily basis for me. So on the right-hand side, it will tell me exactly what data am I actually looking at. And that should be today's date there. Down the bottom here, this is then where I can see all of the data that has been pulled through for me. And what we do is we break it up by sections to make it really easy. We group the reports together to make it easy for you to navigate to the information that you need. So if I'm starting with the overview section, the information that you can see here is the total number of vaccinations that have been given for your patients across your organisations, or organisation if you're looking at this from a practice point of view. So just up the top there, I'm looking at this as a practice. If I was a PCN or ICB member, then I can navigate. By default, it should go there anyway, but I can navigate to either PCN view, ICB view, or practice view. It just depends on who's actually accessing it. So this here at the moment, particularly for flu, we know we've only just started vaccinating now. So this will slowly start to populate over time, this option here, sorry. So at the moment, you'll see any of your at-risk children, any of your pregnant ladies that you've vaccinated, that will start to populate over time. And then from the 3rd of October, we then know we can vaccinate everyone else, over 65s or 18 to 64s, etc. So eventually data will be populated as and when we're vaccinating patients. But it's important to make sure that we're using the right vaccination codes. And that's where you can use Ardens Clinical, which is our System 1 and our EMIS resources to help you with that. So just underneath that, you then got a breakdown of where the vaccinations have been given elsewhere. So it might mean that patients are being vaccinated in pharmacies, or it could be they're being vaccinated in hubs or other healthcare providers, maybe midwives, for instance. So I'll be able to get a breakdown of exactly how many of my patients have been vaccinated elsewhere. I can then see how many patients where they've been vaccinated in this organisation. I can also see the number of patients that have contraindicated and the number of patients that have declined. I can also see my non-responders. So again, this might be quite high at the moment while we're still vaccinating, but over time what we want to see is obviously a decrease in our trends. So remember, against every single report, I'll be able to monitor my progress on the progress bar. I'll be able to monitor my trend, and I'll be able to see how many patients that equates to. So how many patients have basically met the criteria of this particular report. I've then got the option to be able to see how many invitations have been sent from, just like it says here, the 1st of July up until the 31st of March. So I'll be able to see how many first invites have been sent and also how many second invites have been sent. Now, for any of these, I can go in and look at further information if I want to. So I'm just going to switch organisations to be able to show you this clearly. But against each of these, I've got the option to hit view. And what that will do is it will take me into a further breakdown screen so I can further understand that data. So for instance, for my not given, no response, I can click on the view option. And here I'll be able to compare my no response rates against neighbouring practices if I wish to. So providing there is permission, I'll be able to see how my other practices are doing in my area. I'll be able to monitor my trend over time, or if I'm looking at other organisations, perhaps I'm working for the PCN, I can monitor their trend over time as well. I can also compare myself to the Ardens Manager national average. So the Ardens Manager national average is all of the uploads for all of the Ardens Manager customers, and it's then given an average number of that. So I'll be able to roughly see how I compare nationally. Now, just on the right hand side, can you see that you've got a further tab here, which we just introduced about a month ago now. So everyone should be seeing this demographics tab. So what I can then do is hit the demographics tab, and I would then get a better understanding of who is actually not responding at the moment. What age is not responding? What gender is not responding? I can even look at my conditions as well and look to see where there are no responders for the particular long-term condition patients that I have in my organisation. So I can see by far respiratory condition. I've got 97 patients that have still not responded for their vaccination yet. So again, I can then look at prioritising those patients if I feel there's a really important need. I can also look at my deprivation area. I can also look at my core 20 plus information too. So this is all available within the demographics tab, which is available for all of you. So you should be able to see that information now. Just going back to the dashboard, and I may want to look at that demographics tab as well for eventually when my vaccinations start populating, I may want to fully understand that too. So I'll be able to hit on the view button. But if we then look at invitations, and we think to ourselves, okay, if I scroll down, I can see that I've got over 5,000 patients that are eligible to have the vaccine done. But I've only invited over 1,000 of them. So there's still a lot more invitations I need to be sending. So what I can do here is I can assign this particular report to one of my colleagues to make sure that they're then going away and making sure that they're actually getting that work done. So you would then hit the assign button. You can then say exactly which member you want to assign that work to, and they will then get a notification here to let them know that that work has been assigned. And what you can also do is hit on the view button of that report, click on the comments option, and then type any comments of exactly what you want them to be doing. So this is where your planning and your monitoring is coming in by using this tool, by using the assign feature, making sure you've got all of your right staff on the platform, using the assign feature, adding the comments there just to make sure that they know exactly what needs to be done since you've been monitoring the work on the dashboards. And I'm just going to stop there briefly, just while I swap organisations and just to see, Dave, if there are any further questions or any questions that you want to speak about right now.
Nope, I think between Jane and myself, everything's been answered. The only one, and I know you'll touch on this anyway, Charmaine, but it's just about the export of the information.
Yes.
Yeah, perfect.
Yeah, could do that now actually. So just on the top right hand corner, if you wish to export any of this information on the dashboard, on the top right hand corner you've got the export button, and from here you can export it as a PDF or you can export it as a CSV file. So again, worth using that option if you feel that's going to be useful. So hopefully that answers the question that you had there, Dave. Okay, so just scrolling down then, you've also got activity given. So you'll be able to see the number of vaccinations that have been given last month. And then you'll be able to monitor your performance as well. So this is telling you how many vaccinations have been given for your entire eligible patients, so all of your cohorts, all of your patients that need to have their vaccinations done. And then just below that, you can then see a breakdown by age group, by clinical risk group, by other clinical risk groups. So this is looking at your pregnant patients. It's also looking at your care home residents, your carers, any patients that you have deemed as eligible, but they are not eligible per the Green Book. So anyone you've put in a 90X4 code, which is what we say in EMIS, but they need to have a vaccination, those patients will be shown up there too. And then you've got your low uptake groups, so your housebound patients, your pregnant patients, your learning disability patients, etc. So looking at this information here, I can then keep an eye on what my uptake is. And if there are any groups that I wish to further prioritise, then I'll be able to see which groups I want to prioritize, and then hopefully go away and get that work done. So for instance, maybe I'm a PCN, I'm looking at this across my organizations. I really want to focus on my learning disability patients and making sure that they have had their vaccination done. So therefore, again, I can assign this bit of work to a staff member or staff members, which will then send them a notification. I can click on the view option here and click on comment. And then from here, I can then just comment on how I want to improve the uptake of this particular cohort of patients. And then, of course, over time, I then can monitor the trend of the uptake to see whether that has been a success or not. And you can see there that we have several different low uptake groups that you may want to keep an eye on, such as your homeless patients. May be more complicated to get those patients in, so you can monitor how many homeless patients that you have during the flu season and making sure that they're being brought in some way to have their vaccination. You've also got an idea of your number of housebound patients, so do you need to put the right plans in place in order to make sure that they're getting those done on time as well. And like I mentioned, you have got your pregnant patients too. Remember, for your pregnant patients, it's not just flu you need to consider. You also need to consider RSV as well. So that will give you a good idea of your number of pregnant patients that need to be vaccinated. And I think that was pretty much everything that I wanted to show you on the flu dashboard. I just want to double check. One thing to mention as well, these reports here are based on the enhanced service. So it's based on the business rules, which is provided by that enhanced service. If you are looking at your clinical system searches, if you're looking at the searches within EMIS, or if you're looking at the searches within System 1, those are based on the Green Book. So you might find that there is a tiny slight difference in numbers. It shouldn't be massive, but that's the reason why, because this is looking at the enhanced service, and then the actual clinical system searches are based on the Green Book, so that they can be a bit more accurate as well. If you are finding that your numbers are not looking right, hopefully that shouldn't be the case, then you can obviously get in touch with our support team, and we'll then be able to help you with that and look into your data for you. It's also to note that particularly before the performance indicators, when you have so everyone that's been vaccinated, not only will it include who's been vaccinated, but it will also include patients that have got a contraindication code in their record. It will include patients that have a declined code in their record as well. So your percentage is going to be a little bit high because it's including everyone in that performance for you. And then, like I mentioned, it's just worth just looking at your cohorts, deciding on where you want to prioritize your work. Remember, the right hand side will tell you how many patients you still have remaining. So 2 out of 1,323 still need to be done. Remember, we're at the very beginning of the flu season, so we expect the numbers to be quite low. But if you're monitoring this throughout the year, hopefully this will help you to make sure that patients are coming in on time to get their vaccinations done for what they need. And remember, for any of these areas here, so look at my 65 years and over, I can hit that demographics tab just to see again a breakdown of what's happening for my population. So who's been vaccinated, who hasn't been vaccinated, what conditions they have, etc. Any questions, Dave, before I move away from flu?
Nope, I think everything's been answered on the Q&A, Charmaine. Thanks.
Thank you very much. Okay, moving away from flu then, just on the very first tab, you've got your COVID-19. So once you understand how the flu dashboard works, pretty much most of them are the same. They follow a similar structure. So for your COVID-19, this is then giving you a breakdown of your autumn boosters program. So again, it's looking at the total number of patients that have had their COVID vaccination from the 1st of September, which is when we're supposed to be starting it, right up until the end of March next year. Again, it will give you the breakdown of your contraindications, your declines, and how many patients are yet to respond. So again, this is another report that you should be keeping an eye on throughout the year, just to make sure that you are pulling those patients in to make sure that they're getting their vaccinations. It will let you know your first or second invitations. And remember, if you want to plan a push on your invites, you can assign it to particular staff members and make sure that you put some instructions in there on what you want them to be doing. And then you've got your breakdown of performance. So very, very similar to your flu. quite similar cohorts as well, to be honest. So you've got here your over 65s, you've got your at-risk groups in there, and we're also letting you know what your low uptake groups are in case you want to increase the uptake on that too. So that's your COVID. Just down the bottom there as well, on your one, it will also show you patients that have had 1 dose of COVID, 2 doses of COVID, and 3 doses of COVID as well. So you'll be able to see that on yours. The RSV one, so this is new for this year. Remember, we can't be vaccinating any patients until after the 1st of September. I'm just going to switch screens so that I can show you what that looks like. So this here will just give you the number of vaccinations that you have given for RSV. Now, you're probably fully aware of how this is all going to be working right now, but remember, you've got almost 2 cohorts that you're focusing on. You're focusing on your routine cohort of patients, which will be your patients who are pregnant and are over 28 weeks. You're also looking at your patients who are turning 75. But also this year as well, you are doing a catch-up. So you're looking at anyone who's already the ages of 75 to 79. You're also looking at anyone turning 80. So what the dashboard would do is it will give you an idea of who your eligible patients are, so how many those are for your population. And then it will give you that breakdown by your age group. It will tell you what your catch-up cohort is looking like and also what your routine cohort is looking like as well. So if you wanted to prioritise to make sure you've got all of your catch-up done, you'll then be able to see your progress of that throughout the time that you're doing it. And there you've got your pregnant patients as well. And again, like all of these, you can hit on the view option and that will allow you to see further breakdown of that information too. And then you also have childhood IMS. So for your childhood IMS, this is just giving you data on the vaccinations that have been given and by what type. So I'll be able to see the total number of 6-in-1s I've given for my organisation, my 5-in-1s if I'm still doing that, Hep B, HPV, etc. And you've also got down the bottom here your vaccination activity. So it will show you how many vaccinations have been given correctly and in time for your patients who are between 8 weeks to 12 weeks old, 12 weeks to 16 weeks old. So this is just a good way of being able to check your progress over time and checking to see whether patients are getting everything that they need in time as well. You've got your pertussis, so focusing on your pregnant ladies, looking at the invites that you have sent, what's given and what is still due. So this is another one that you should be keeping an eye on. You've got your pneumococcal, so this is looking mainly at adults, telling you again of how many vaccinations that have been given. And then you've got your shingles dashboard. So for your shingles here, you've got a breakdown of how many vaccinations have been given, how many patients that were eligible and have been vaccinated, so that you've got that performance indicator as well. That is mainly everything for the vaccination dashboard. So hopefully that's quite straightforward, but I think definitely at this point of year, it's keeping an eye on your first invitations and second invitations and making sure that number is where you expect it to be. I would also be looking at your performance over time as well and looking at how many of your eligible patients have actually been vaccinated and using these breakdown of information to really be able to prioritise what work you want to increase your uptake on. And remember, this dashboard doesn't just have to be used by practices to monitor their own progress. You've also can be using this as part of a PCN to monitor it across your PCN. And like I mentioned earlier, also your ICB as well. It is going to give you a good understanding of what your national vaccination programme is looking like for the year. And what I would suggest as well, not only looking at the vaccination dashboard, now you understand how many eligible patients you have and how many you've vaccinated and how many you've not vaccinated. It's also worth noting that we do have the appointment dashboard, which you can then use to give you a good idea of what your capacity is looking like and if you can actually achieve all of these different vaccinations for your patients. So the vaccination dashboard, the appointment dashboard, sorry, you can access via the services module. And just up the top there, you've got the option for appointments. And we did a webinar on this about a month ago now, so we'll make sure that we'll send the recording over for you. But it's going to give you an advanced insight on how your appointments are being used and what they look like in the future. So your past appointment tab will tell you all of the appointments that you've used so far, how many of those were DNA'd and how many of those are wasted. But what you can do in line with your vaccination work is you could be looking at your future appointments. And I'm going to swap so I can show you this a bit better. And I'll be able to see the total number of appointments that I have available. So I can click on the view option to see further information. I'll be able to see how many appointments have been offered, not just for my organisation, but other organisations in my area. Soon to be coming, and very, very soon, you'll have some more tabs that you'll be able to click on the right-hand side. So at the moment, for most dashboards, you'll only see trend, demographics and rules. But what you have coming up soon is the staff tab. And what the staff tab will allow you to do is a breakdown of that activity by staff role. So for those appointments, I can see how many nurse appointments have been used, how many GP appointments have been used, etc. We are also going to have a further breakdown on your appointment activity, which will allow you to see your appointment slot type. So not only will you be able to see numbers, but you'll be able to see exactly what slots are available. And that might be really handy if you're using a slot type for your vaccination clinics, for instance. You'll be able to clearly see exactly how many you have left and how many have not been used yet. Now, for all of our dashboards at the moment, you are only seeing numbers. You're not seeing patient information at the moment. But in a month's time, maybe even sooner than that, what we're preparing for is our PID launch, which means that soon you'll have a patients tab within your further breakdown screen. And that will allow you, it's not going to let me show you this on the test environment right now, but you'll be able to click on the patient tab and you'll be able to actually see which of those patients or who those patients are. And from there, you'll be able to then access the patients within the clinical system. So this is coming. It's going to be massive, and it's just going to be an extra way of you really being able to use this platform to help you with your planning and monitoring of your primary care work. Any questions, Dave, or anything more that you would like to add from your end, or just generally speak about some of the questions we've had coming in? That'd be quite interesting.
Nothing to add. I think all of the questions have been answered. There may be one or two we just need to get round to everyone, but nothing out of the ordinary, if I'm perfectly honest, Charmaine. Yeah, there was a really good question around patient identifiable information. So bringing that into the dashboard in the very near future. But I think the majority of them have just been little sort of maybe hiccups where, yeah, maybe people just need to get in touch with our support team just to reach out. Everyone's got the email address there. So yeah, if there is any concerns about your dashboards not maybe refreshing as quickly as you'd like them to, then just get in touch with our support teams. Thank you.
Thank you. Okay, well, that is everything that I had to show you today. So I really hope that you have found that useful. I really hope that you can find the benefits of how this is going to help you manage your vaccination programs throughout the year. And like I always say, when it comes to Ardens Manager, try to make sure that you are using it out throughout the year, because it's going to give you a good idea of what's going on. It's going to highlight where work needs to be done. It's going to give you that ability to be able to plan and deliver your work in time. So just make sure that you do have the correct access to it. You do have your staff members who have access to it as well. So remember, you can use your ad staff. And you can contact us for any further trainings. If you want this training session for your own organisation so you can have a look at your own data, then that's absolutely fine. We've got plenty of different training and product specialists that can come out to you and give you that training if needed. So on that note then, I told you it wouldn't take the whole hour, but hopefully that has been useful. I'm just going to open up my presentation slides just to show you the last few slides now. It's just to mention that we do have loads of different training material for you to be able to access. We've got the Ardens Academy, which is our free online learning platform, which allows you to learn Ardens in small bite-sized chunks. So in a minute, I'm going to pull up another QR code. If you're not signed up for it, then I definitely recommend that you do. We have little modules on how to use our flu resources as well. And you will get a certificate at the end to say that you've completed it. So you can use that as part of your professional development. We do also have in-app walkthroughs. So you may have noticed just recently when you've logged into Ardens Manager, we're telling you about all of our different new features. So watch out for that, because that will walk you through information that is important for you to know. And we do have loads of support articles, which we've been posting as we've been going along as well, which will give you step-by-step instructions on how to use the different tools. Here's Ardens Academy. So remember, that's our free online learning platform. If you haven't signed up for it yet, then here is our QR code. So if you just scan that QR code there, that will take you directly in for you to sign up. It's free for all of our customers. You just need to have an nhs.net account. If you don't, but you work in practice and you're struggling to get in, then you can contact our training team. And if you do want any extra training, you can contact us, training@ardens.org.uk, and then we'll be able to help you out and book some training in if needed. And lastly, always welcome any feedback. So I'll leave that QR code up there. If you have any feedback about the webinar and how we can improve going forwards, or perhaps you have any feedback around the platform itself, then do get in contact. Click on that QR code. Really interested to hear some of your questions and your feedback from today. I've given you about 25 minutes back, which is probably needed in practice land. So thank you so much for attending. Hope you found this useful, and we look forward to seeing you on the next webinar. We're actually doing a webinar on Tuesday for introduction to QoF for non-clinical staff. So if you've got reception team who are brand new to QoF and you want them to know a little bit more, then get in contact with us. We'll put the upcoming webinar page on there, and you can register your receptionist on there if you think it'd be good. And it'll be myself delivering that one as well. Thank you very much, and I hope you all enjoy the rest of your day.